Thank you so much, Bianca Menengage, to invite us all for this session. I'm really delighted to be here with you. Very briefly, I'm Clara Aleman, the Director of Programs at Equimundo, Center for Masculinities and Social Justice. I'm from Argentina, currently based in The Hague. One of the strategic priorities or pillars of Equimundo is working to promote equality of care, and so engaging men as fathers or male caregivers together with women and all caregivers in advancing care equality and violence-free relationships. I'm also a mentor at the Prevention Collaborative, with whom we've developed research, resources, and guidance for working at what we call the intersections of violence against children and violence against women. So I'm going to tell you very briefly what will happen in the session today. I will first share what we are doing with the Parenting Affinity Group, who are we, why we came together, and how we aim to support a growing community of practitioners working with parents, caregivers, to prevent violence in the family. Second, I'm going to set the scene and provide some insights, very brief overview coming from a set of knowledge resources we are about to publish, and making the case based on the evidence of why parenting programs are a critical space to advance gender equality, promote healthy masculinities, and prevent intergenerational violence. I'll provide, again, this which is much more developed in the resources. How can these programs address the drivers of both types of violence, and what do effective programs look like? And I guess the most interesting part will be hearing from very seasoned researchers and practitioners that are already working in programs of this type in the design, implementation, or have already evaluated programs that are engaging men alongside women through parenting or strengthening parenting skills in the prevention of violence in the family. I'll introduce our speakers in just a minute when I also give them the word, but first I'll go through what I just mentioned. So who is the Parenting Affinity Group? 2 years ago, we came together with colleagues of UNICEF, Innocenti, the Prevention Collaborative, and Equimundo as the Parenting Affinity Group to join efforts around our shared goal of stopping the intergenerational transmission of violence and addressing the social, normative, and gender drivers of both violence against children and violence against women. Knowing that there's many other factors, but focusing on those gender and normative aspects of violence. In the past few years, there has been a promising surge in the willingness on the part of women's rights, feminist, and children's rights organizations to explore opportunities to work together on violence against children and intimate partner violence in the family. Although traditionally, I would say historically, and still, there's been reluctance on the part of both groups to join forces due to differences in ideology or separate donor streams, and the belief from both groups that working for the prevention of violence or children would deprioritize the unique needs of one or the other, right? Depending on what the focus of their work is. Recently, however, some groups have come to recognize that the needs of women and those of children when it comes to addressing violence are not in opposition, but actually quite complementary. And research confirms, as many of you know by now, that protecting children from violence, being exposed to violence during their early years, either as a witness or as a victim, is essential to reducing levels of intimate partner violence in adulthood, and thus working at what we call, again, the intersection of both types of violence is a very strategic sphere of action. So our aim with the Parenting Affinity Group is to contribute to collective understanding among these groups and all those working to strengthen family through policies and programs, and to cultivate interest among organizations that are already working in this sector, in this field, to intentionally address and prevent both types of violence and strengthen efforts in doing so. So to that end, because we know many want to do it, but don't know exactly how to, so we've just produced evidence-based resources to support parenting programs to integrate a gender-transformative lens or strategies and as an opportunity to reduce both types of violence. So if you were to make the case or need to discuss with government implementing policy on parenting that is not yet doing this kind of work, what are the main reasons and why is it working at the intersection important for parenting programs? First is the issue of co-occurrence, right? It's well documented that intimate partner violence, violence against or violent discipline often co-occur in families, and this seriously compromises children's health, development, and well-being through common and compounding negative consequences that affect their physical, mental health, cognitive, and socio-emotional and behavioral development, as well as their capacity to attach to others in safe and healthy ways. It affects children's capacity to regulate their own emotions and interact with others in healthy ways. On the other hand, women experiencing intimate partner violence, of course, we know face myriad social, economic, physical, and mental health consequences that undermine their ability to bond with their children and to provide nurturing care. Relationship conflicts among parents increases levels of stress and decreases, let's say, the quality of their relationship with their children and the home environment, affecting their capacity to self-regulate, therefore increasing the chances of using violent discipline. And ultimately, also, we know through evidence that violence has long-term and intergenerational consequences, not only for children, for women, and for men. Children in violent homes learn that violence might be a normal way to resolve conflict, and so this exposure to violence is not only affecting their future capacity to partner and parent, it also alters the way the brain and impulse control function works, increasing the risk of violence or experiencing and perpetrating violence later in life. So an overview, but the main point is also that violence against children and against women share these common risk factors and the norms that are driving the violence, both at the family and societal level. We'll unpack briefly these in a minute, but the one prevailing risk factor that permeates all of the levels of the socio-ecological model we know are rigid or restrictive gender norms, legitimizing male dominance in the household, rigid notions of masculinity based on control and the use of violence to resolve conflicts and educate or correct misbehavior when as a necessary way, right? So all of these become entry points for programs such as parenting programs to challenge these shared beliefs and attitudes that sustain norms and behaviors to address both violent discipline and intimate partner violence. So this is, you might have seen this model. I'm not going to go into details, but yes, in the knowledge briefs that I'll be sharing you later how to access them, and many studies in all countries of high, medium, and low income find that there are these shared risk factors, right? And that in societies where there's weak legal sanctions against violence, so let's start by the societal level, to social norms that condone violence, where there's high levels of social, economic, political gender inequality, and on the other hand, at the level of families and couples and individuals, families experience marital conflict, family breakdown, economic stress, male unemployment, and these restrictive gender norms, they are more likely to experience both child maltreatment and partner violence. And this is why the interventions, violence prevention programs including parenting, that can address many of these underlying risk factors driving violence and gender inequalities at the individual, couples, household, or community levels, are what we call a unique and strategic space of action to prevent both types of violence. So here, again, this is a very busy slide, which I won't go into, but to the right, the tiny writing from a resource from the Prevention Collaborative on causes of violence shows you the different approaches and strategies that have been showed by the evidence to reduce the risk factors for violence and thus strengthen the protective factors against violence. And just highlighting a few of those that parenting programs can intentionally include into their strategies are at the interpersonal household level. They are doing or could reduce exposure to violence in the family, teaching positive and non-violent strategies for disciplining children, challenging gender inequality and division of labor in the household. At the level of couples, those working with fathers, mothers, live they together or not, but let's say co-parents or other caregivers, catalyzing reflection on inequitable gender norms, responsibilities and entitlements, strengthening skills such as communication, sharing, decision-making, conflict resolution without violence, and also promoting empathy and deep listening. Also, of course, these are things that also can be done with individual parents, women, men, and individuals of all gender identities. Of course, another driver is mental health, right? So these programs can, and some do, focus on enhancing mental health and emotional regulation skills. So very, very rapidly providing some of the unpacking what's in the both risk factors and effective strategies that could address them, and why this makes parenting programs an excellent, say, modality or way, and they are in a unique position to strengthen parents' awareness, relationships, and skills to reduce both types of violence, intimate partner violence and violence against children, as well as promote caregivers' mental health and well-being. Some parenting programs are already doing this, and our 4 speakers today will be sharing about their experiences doing this. But very few, if we look at the large amount of parenting programs and policies that exist globally, very few are intentionally seeking to address intimate partner violence at the same time by addressing these common risk factors and the gender norms that drive both types of violence, but also offer common solutions. There is a growing number of parenting programs seeking to reduce violence in the families of both types of violence. And the evidence that they can do so effectively is also growing and encouraging. So this is why a key message I would like everybody to take away today is that failing to address both types of violence is a missed opportunity, an enormous missed opportunity, and that it may even undermine the desired outcomes of parenting or family strengthening programs. For example, a program that is addressing violent discipline against children, but not intimate partner violence, may find that parents are ultimately unable to develop healthy, caring, and modeling healthy relationships and interactions and adopt those positive parenting practices that the program is trying to transmit. And where programs are successful at reducing violent discipline, children may still be exposed to intimate partner violence and its long-term consequences, undermining, again, the ultimate goals of the parenting program. So, as mentioned before, addressing these common risk and restrictive gender norms, risk factors and norms, provides entry points to adapt parenting programs to address these intersections in an effective way. And this also can amplify, not only reduce violence, but the programs that are doing this have also found lots of other positive results such as improving parent-child interactions, increasing men's involvement in caregiving and domestic work, increasing women's participation in decision-making, and general enhancements of well-being and health for everyone in the family. So these programs, finding all these kinds of positive outcomes in many domains of health and well-being, were designed as what we call gender-transformative programs, recognizing the role of gender inequality in perpetuating violence. So they intentionally address that. They interact with caregivers at a critical time of their lives, and thus can work with them to reflect on the consequences of restrictive gender norms and about how these are shaping their parenting practices and the environments where children are raised, and therefore restricting in a way their possibilities for their full development and opportunities in life. They also are looking to promote caring and nonviolent families where men and women share responsibilities and children then are raised free of gender stereotypes. So some other features of what we call gender transformative or effective programs, and what do they look like? They always engage fathers and male caregivers as equitable parents alongside mothers and female caregivers. They do this by listening to women's preferences and concerns about men's greater participation in their children's lives. Second, we mentioned they challenge or transform or seek to transform gender roles, norms, and power imbalances. They promote always critical reflection on these same gender norms or restrictive gender norms, and support parents in identifying ultimately what are the benefits of more equitable ways of sharing, of being, of taking decisions and responsibilities. They apply a strength-based approach. This means meeting parents where they are. They recognize that parents want the best for their children. They don't tell them what to do or that they are doing things incorrectly or failing. What they want is to parents to feel more, say, competent as parents, and recognizing everything they are doing already, which is probably just fine, and nurturing, and so building on those practices. These programs ultimately then aim to strengthen relationship parenting skills, including, as I mentioned before, communication, emotional regulation, and positive parenting. And very importantly, last but very importantly, they do so. They raise awareness about the consequences of violence and ensure women and children's safety. And this is connecting, developing the referral pathways and identifying and connecting those that might be experiencing violence with competent and services, because challenging these restrictive gender norms, we know, might generate backlash or negative consequences for women and involved. So with no further ado, thanks for listening for this longish introduction. I wanted to introduce our stellar speakers today and my co-facilitator, Vessel. So I'll start by, if you see the picture to my left, Suna Hanos Penny. She's Director of Strategy, International Programs and Partnerships at CHEF, that's the Mother-Child Education Foundation in Istanbul. Emmanuel Karamage, Coordinator of the Bandeberejo Scale-Up at the Rwanda Men's Resource Center, RAMREC. Cristina Alvarez Vargas, she's a researcher and teacher at CINDE Foundation. She's the coordinator of Paternar, which is an adaptation of Program P in Colombia. Jean de Dieu, I don't know if he managed to connect. He was, I introduce him in case he arrives. He's Jean de Dieu Hatekimana Ndius. He's a prevention specialist at the International Rescue Committee based in Goma, from Goma in the Democratic Republic of Congo. Finally, I'll introduce us, Wessel van den Berg. He's a men care officer at Equimundo and is from South Africa. He will be facilitating the conversation in a few minutes. And myself, I already introduced myself. So I'm going to ask each of our speakers to introduce their program in just 2 minutes, because then in the open conversation, in a dialogue, we'll get to hone into much more details about how they've been doing the kinds of things I very briefly described before. So, Emmanuel, would you like to start us off and tell us about Bandeberejo?
Yeah, thank you, Clara. Thank you, everybody. Vandebireho is a role model in Kinyarwanda, a role model in English. The program is engaging men in maternal newborn child health, in caregiving, and violence prevention, where fatherhood is at an entry point to work with the men alongside with the fellow women. I would say we work with as a couple. We have a 17 session organized on weekly basis, whereby 10 sessions are meant for couples and 7 sessions are meant for women only. We engage men in reproductive, maternal and child health, in caregiving, but also in health couple relationship. The program was piloted in Rwanda from 2013 up to 2015. Then we organized a transition to scale from 2009 up to 2020. Now, currently, we are implementing the scale up in 3 districts where we are implementing the program together with the government, hand in hand with the government of Rwanda, through the health system of community health workers implemented together between Rwamrek and the Rwanda Biomedical Center. I would say, in short, we had 2 type of evaluation. We did a randomized control trial after the pilot phase, and we did another one after 6 years follow-up to assess the long-run sustainability of impact on the beneficiaries. I would say maybe we will discuss more later, but the same impact from the pilot is the same, almost the same after 6 years follow-up. Thank you so much.
Amazing. So I'll now hand it over to Cristina Alvarez from Colombia.
Good morning. Thank you, everyone. Paternar, it's a program whose goal is to promote co-responsible and non-violent parenting in male caregivers and fathers of children. We work in Paternar. We have been working from 2020, and we started with the first round of implementations with 8 parents that belong to migrant communities, migrants from Venezuela, or with people that were displaced due to the Colombian armed conflict. That was our first round. We worked with 180 parents, and the sessions were in-person sessions. They took place once a week during 8 weeks. During some sessions, we worked only with fathers, and some others with mothers only, and then with couples. And last year and until 2024, we have been doing some changes and modifications to interact digital material, because the pandemic has taught us that we need to create a program not only to engage them in a better way, but also for them to remain all throughout the process, especially because these fathers live probably in difficult conditions. They have informal work, or maybe they work long hours or very difficult at difficult times. So we are working on adapting the Paternar program to have a hybrid program. So we are going to open also our program for people who live in contexts of social vulnerability. The key outcomes of our program during the first phase was to increase the participation of men in the upbringing and co-responsible care of their children. This is not common in our communities. In general, men have like more different tasks like working, but have nothing to do with working within the domestic environment. So we also increase families' communication. We increase families' knowledge of child development or what was expected from them during the life of their children, especially at early ages. And to create like a gender socialization and positive parenting, raising awareness about what violence means for children. So we first approached 180 fathers together with their couples and kids. And now for this second phase, we expect to increase the participation of men in the upbringing and co-responsible care of their children. We also would like to teach them about gender socialization and positive parenting from the early ages of their kids. And we want also to provide men with nonviolent and empathetic strategies to express their emotions. These are exercises to teach them on how to do it, because sometimes in this context, emotions are not things that males speak about. I'll also create and strengthen support networks for men and their families on issues related to parenting, care, and the expression of emotions. We expect to work with 250 fathers together with mothers and couples.
Muchísimas gracias, Chris. Jean de Dieu, à toi. Bienvenue.
Thank you for giving me the floor. Much. So I'm Jean de Dieu, and I live in the Democratic Republic of Congo. Thank you for this program. We have worked on this safe at home approach. It's a preventing approach to protect women and children against abuse. It is a project that has been implemented in 2017. It was a question to work on research, to work with the population to see how to fight against violence and protect women and children, integrating this approach into the houses, into the homes, because, for example, we have seen that it was a violence against women that had consequences on the life of children. And if the woman is violent against her child, it is a violence against the children that was first a violence against the women, and then afterward it began to be a violence against the children, and then the father is going to be violent also. So we have worked on that issue, and we wanted to integrate this work. In 2018, we have worked in the Democratic Republic of Congo, and the experience showed us that it is very important to speak about that, because 75% of the participants that were using intimate partner violence against women in the couple had to reduce the violence against the members of community and of society. It means that it was a clear reduction of violence against women and children. And we also have seen that that we had a strong reduction in the use of severe physical and psychological discipline of children by women and men caregivers, respectively. And because it was proven by researchers, women are always with the children, and they are near the children, and they are frequently responsible of the violence against children. So this is the research we have done during the 3 last months. with the changes we have seen during those last months. Also, it was a good work, and we had a positive trends in other aspects of family well-being, as it was said before, including a reduced acceptance of harsh discipline of children and women, and an increased power sharing between the couple. Generally, there is this idea that power is for men, and that the women can participate to the decision taking. And with this approach, we improved these gender equitable attitudes and increased positive parenting skills. And also, we had a change in the relation between the parents, and when there was a problem, when there was some stress, we worked with the parent to see how to work against violence for the children, and it was a way to improve the approach. And today we are working with those couples to see how we can apply that to the rest of the community. We have started with working with 200 couples with discussion for women, discussion for men. And when we worked with women, we have sessions organized with women. And those sessions are facilitated by a woman. And we have also 4 sessions for men with a man facilitator. And those sessions, there are also other family sessions with 5 family sessions in which we have through 3 sessions working with the couples, discussing with the couples, women and men, speaking about the problems they have, trying to work on the decision taking in the family, the communication into the family, working on that. And it is very important for the community that the women and the men can discuss together. And then there will be 3 sessions with men and women in couple, and we have session in which the children also can participate. The children can give their opinion, their ideas, so they can participate in the sessions with their parents. And it is a very good work, a very good session in which the children are going to give their opinion with their parents, listening to them, and everybody is going to accept the opinion of the children. And there is a communication with the child, with his parents, with the parents together, and everybody is happy about that. And we can see that the child can be a witness, sometimes a witness of the violence between the man and the woman. And the child is watching this violence between his parents, and it's bad. So for us, through this family session, the child can speak about this violence, participate to another step in which there is a communication between his parents. So this is the reason why we spoke about this approach, and we thought that it was a very good approach to work with family, and that we have to apply that to the crisis that we can see in the community, that we can identify in the families, to fight against the violence against women and children at home. So this is what I wanted to tell you about the research and the work we have done in Congo. Thank you very much.
Merci beaucoup, Jean de Dieu. Je passe la parole. Sorry, I now hand it over to Suna. Thank you so much to being here with us to share about Father Support Program.
Thank you so much. It's a great honor to have this opportunity for me to speak at this event on behalf of ACHEV. And thank you to all the partners, UNICEF, Prevention Collaborative, and Equimundo, because you're trying to build this collective understanding and collaboration among us researchers, practitioners who are already working at the intersection of these areas. So ACHEV, we're celebrating our 30th year this year. It's founded in Istanbul, Turkey. And our mission has been to make a lasting contribution to society through the development of children and their environments. So we're very much at the intersection of early childhood development and gender equality and violence against women and children. And through our face-to-face programs, we've now over 30 years reached over 1 million children, mothers, fathers, and women. Now, I'm showing it on the slide, we really do believe gender equality begins in the home, and we see fatherhood as a space for the recreation of gender roles. So we know that by strengthening involved fatherhood, we can actually make a change in the direction of a more equitable household. In other words, we can talk about democratizing the home environment, and Father Support Program is a primary prevention strategy for that. Back in 2017, it was recognized as a best practice program by UN Women. Now, what does the program do? It's actually a group program geared towards fathers who have children between the ages of 3 to 11, to various groups based on the ages. And it's implemented over a period of 14 sessions. Every week, the sessions take about 2.5 hours, and about 15 to 20 fathers are convening. It's a very structured program. We have a very structured curricula which we give to facilitators that is very clear, well-organized manual, and has sequential chapters. And the model of working with a group of fathers has proven very effective in promoting behavior and attitude change. The purpose of each session is to educate fathers on a topic related to child development, effective communication, various behavior instilling methods with children, effective how to express yourself, how to listen effectively, family's role in child development, and other topics. And it's a two-generation approach, where fathers are attending these meetings every week, but then when they go home, we send them home with daily activities to do with their children. And in the last maybe 15 seconds, I can just tell you quickly some program results. The fathers were found to have their changed behavior towards their children and wives. They spent more time with their children, refrained from physical punishment, decreased their usage of negative disciplinary methods, instead replaced it with more positive disciplinary methods. They were more open to having a constructive engagement. I'll pause there and then we can talk more later. Thanks.
Thank you so much. And yeah, you'll have the chance to, in the conversation, I think, bring up so much of the richness of all of these programs. So, sorry, there was one more. Suna, do you want to talk about this one?
No, I talked about over the slide too, please. I know we will have a chance to talk.
Great. So I'm going to talk at the end about the resources we've produced to address exactly these types of things. But so we'll now hand it over to my amazing co-facilitator, Vessel, and over to you.
Thank you so much, Clara. It's wonderful to see everybody on the call, and it's so nice to see many familiar faces and familiar names around the world, also from South Africa. So it's wonderful to see the positive parenting implementing network in South Africa, SAPIN, on the call, and Nikki and lots of friendly people. So it's wonderful to do this. Colleagues, I'm going to host a conversation amongst our 4 wonderful presenters and just delve a little bit deeper and really give you the opportunity to speak about the lessons and the experiences that you've had in actually implementing these programs. And Christina, I'm going to start with you. The question is, and then Jean de Dieu, you can become ready because I'm also going to ask you the same question. So we've gone into the very detailed nitty-gritty of each of the programs. Now we're going back towards quite a strategic question again. And this question is, why do you think violence prevention matters for parenting programs? So let me pass that to you, Christina, and then we'll go to Jean de Dieu after that.
Yes, parenting programs must involve the exercise of thinking and questioning violence, precisely because violent discipline methods have been very much rooted in our cultures particularly and have not been questioned. Not only methods in and of themselves, but also ideas that are underlying those methods, the beliefs underlying those methods. We are not generally questioning them. We are considered them just common because in other generations, they had not been questioned. So for us to include the violence prevention, but on the basis of questioning those beliefs is fundamental. And also, many of them are rooted in families, but also are permanently reinforced by society, by advertisement campaigns or daily conversations even. So questioning them within the programs of parenting is fundamental for us in order to exercise parenting differently, being aware of the consequences, not only for the present time, but also in the medium and long term, the use of violence as a parenting method. And second, many times that violence starts within the couple. So some couples believe that that does not influence their children, that this is an adult problem. And actually children are constantly exposed to those situations and also develop behavior and reproduce that violence.
Thank you so much. Let me pass to Jean de Dieu. I see your camera is off. I'm not sure if you're still with us, Jean de Dieu. So the question is from your perspective, from the IRC and the Safe at Home program, how does violence prevention matter to parenting?
In general, we have trainings with regard to the violence made against women and children. Well, we have realized that there are many women that show up and they are more than the men. Well, of course, women say that it is better to integrate men in our efforts to combat violence in the family. That's in this way, we have decided to integrate men in a systematic way. And well, this allows men to have a chat, to discuss things between them. And there are women as well that have a discussion. And well, we try to make the best in order to make our best in order to have men participate in these discussions on violence. With time, we have noticed that if a woman participates in a certain approach without her husband participating in it, violence will be considered as an outer effect, an outside effect. If someone participates in a program to prevent violence, but without the participation of the woman, then we consider that the couple does not consider this type of violence. And well, it is considered that this type of violence is not taken into account. So we try to have an integrated approach to have both men and women participate, the entirety of the couple, to prevent violence against women and girls and against children, because it is necessary for people to understand that violence starts at home. So if when violence is committed at home, it is men that are the first perpetrators. So in order to work out the situation, it is necessary to rethink things. It is necessary for men to rethink things. It is necessary for men to question their attitudes and their behaviors, and especially the behaviors that they perpetrate against their wives. So it is necessary to foster proper relationship between men and women, and that is in turn in connection with the relationship that the guys have with their kids. So it's a whole package, you know, so the relationship within the couple and the relationship that the men have with their kids. So it's that means that when we fight against violence committed against women, we also, by transitive effect, so to speak, combat violence perpetrated against kids. So we try to work with the entirety of the family, so as to develop good well-being and good health in general. So if we talk just about women and not about kids, and imagine that there is a mom that is not good towards their kids, so it's the kids that suffer at the end of the day. So what about kids that suffer as well because they see that their mother is suffering as well? So therefore, our approach is based on the fact that guys need to be integrated in their homes, and we need to work on the way that men can share their power with their wives, and we work against mistreatment against their kids and against their wives as well. So this approach has a huge importance because it has to do with the protection of both the wives and the kids. Thank you.
Okay, great. Thank you. Thank you. But just to think this whole systems approach to the family, and I think, of course, the evidence has been quite clear about the fact that involving a couple at the start immediately directly may also increase risk of violence. So it was nice to see in the Safe at Home program that there was a separate engagement with women and a separate engagement with men. And some programs then bring the couples together later if there's an assessment that that shows that as safe. But there's also the risk of working with women and men together who are in the same household. That might be a risky step as well. I wanted to just follow on with you, Emmanuel, on the point that Jean de Dieu and Christina had made about this importance of working with both members of the couple as a component of success. In addition to that, could you speak from Banda Berejo about other ingredients or components that might explain the successful outcomes that you've seen? So what are some of the other elements that have been successful, particularly in preventing intimate partner violence and violence against children?
Thank you, Viso. In Ibandevireho, the program was adapted to the Rwandan context because the harmful norms and the even practical gender norms that are existing in the community are so many, but we did a formative research to understand which type of social norms is influencing or is perpetuating violence against women and against children in our community. And then after a kind of formative research to understand where we are, we elaborated a kind of training module based on gender transformative approach, where the issue was to tackle on the harmful and social norms that perpetuate violence against women and against children. And later on, we realized that a participatory method is a key ingredient because the program, as long as it was adapted to the Rwandan context, community members see that as not imported. It is like a homegrown solution where we involve the local leaders and even district leaders and then high-level leaders. As far as we are implementing, the high-level leaders are supporting the program to be implemented in one way, in another way. But also evidence generation to convince even government leaders. The model is tackling the issue of violence against women and against the children. And we have a strong evidence around that to convince others the model is the best one to tackle the violence against women and against the children in our community. And maybe I will leave the floor to my colleagues to continue. But in Rwanda is what we did. And then it is working well because we are now scaling up the program in collaboration with the government.
Thanks so much, Emmanuel. I am going to ask Suna just to come in on this topic of working with fathers and to ask two questions in one. So the first one is whether this intent to work with fathers or male caregivers from a healthy masculinities and from a feminist lens was intentional from the start, and what sparked that. So that's the first part of the question, is working from this healthy feminist approach. What led to that? And then secondly, what were the challenges in working with fathers? As a very broad question. I know we can do a whole webinar just on that, but maybe the top few. So what sparked the approach, and what were the challenges in engaging fathers?
Okay, these are two very broad questions.
I know.
But I'll try. So I think the first one is a very good question, because strategically, how we all find ways to navigate around those challenges in our context and be able to have successful program implementations is highly critical. So anecdotally, no, the Father Support Program started out with not completely, but with a different idea. It was in response to mothers who had participated in Achev's Mother Support Program, and they were demanding that the fathers also be offered similar training because they're not very supportive in the home, and they wanted like some unity in parenting. So yes, there was a gender transformative component, but that language, those terminologies were definitely not there. Not there in our minds as well. This is back in 1996. It was in about 2011 when we understood that an effective early childhood development program has to be grounded in gender equality and women's rights. But still, today, we don't explicitly promote it that way. We use it as an entry point. It's a pathway to prevent violence and achieve what we're trying to achieve. But we explicitly engage men as involved parents, as engaged parents, caregivers. So the design of the messaging, the content, the recruitment strategies, we really try to appeal to men. Generally, our goal is to be accepted by the society, because this connects actually to the challenges part. These are very sensitive topics. First of all, I'm just thinking of the challenges and I don't even know where to begin from. Violence against women, particularly intimate partner violence and sexual violence, is a huge major public health problem in Turkey. And then there's this whole civil society shrinking issue, like where there are some pockets in civil society where civil society actors or academics are pushing for more progressive policies all the time, but generally it's a shrinking area, and conservatism in the policies towards women, families are increasing. So then how do you really bring up the gender equality, which is a very sensitive topic? There's so much more I can say, but if you'd like, I can pause here and then we can come back to it.
Sure. Thanks, Suna. Maybe just in one sentence, or in a kind of a succinct, again, it's a very broad question, but since you've been doing it for such a long time, what has been the most successful, or have you been equally successful in both, in the gender and IPV, or in the strengthening the original ECD focused intent of strengthening parent-child relationships and focusing on violent discipline?
More, I want to say both, but if I need to choose, I would say the second one. More early childhood development. How do you create a peaceful home environment? Violence against children. These are more common denominators. They're more shared values across different parts of society.
Right.
Importance of child development includes so much. It really includes gender equality, but it's been a bit easier to capture fathers when you talk about violence against children. Then you go into violence against women, and the programs have
Right.
really shown impact on that end.
Yeah. No, wonderful. Thank you, Suna. And Christina, I can see you're agreeing with that point. Can I ask you a question about Paternar? And that is what so following on from Suna's point, what were the key norms, the key gendered norms that and attitudes and practices that Paternar sought to address, or is seeking to address? Sorry.
Yes, thank you. I was nodding when Suna spoke because it has happened something similar to us in Paternar. Addressing gender violence brings like resistance from parents. So we speak first about violence against children or physical violence, like some other topics to reach what we want to address. And as regards gender norms, in Paternar, we are key for all our work, for all the work we then develop. And we speak about, for example, the division of work and the idea that that men work and women are the ones who take care of households and kids. This is something that is all the time in the narratives here. So we're thinking about how to change this and not to think about care as a task of women only. So these gender norms are being questioned, because this has not only to do with what happens within families, but within extended contexts that deal with these gender norms, and which, for example, children at school. In general, those tasks are relating with women, or that are moms, the ones that work with children in school tasks. So from Paternar, we are all the time trying to work on engaging fathers, involving them on different tasks, for them to find moments, spaces where they can do activities with their children, get involved with school activities, for example. Probably these are things that they haven't thought before. Fathers probably didn't think about doing those things before. So we need to change attitudes, practices, and work with parents towards a more on reflecting on a self-reflection of what they do with daily tasks, that probably they don't question themselves when thinking about these things. And we consider that these are the presence of fathers in, for example, school activities, household activities, is key for the family. So we have to eradicate this image of seeing women as the ones who take care of children and who do care work at homes, and fathers as the ones who work only.
Thank you so much, Christina. And just having that, regardless of the task. I mean, I'm just reflecting on my daughter is learning how to skateboard, and I'm teaching her how to ride on a skateboard, and we are spending a lot of time together, getting some scraped elbows and knees. And it's so wonderful to just see how important that time together is. So I'm going to go from the very micro of that interaction between a father and a child to a very macro question. And Emmanuel, in the context of Rwanda, you had spoken about the increased government support for supporting Bandabereho, and also the community's buy-in in the project. Could you tell me what the main entry points and arguments are that you found effective to gain this support for the implementation of the program? So let's hear from Rwanda.
Thank you, Veso. First of all, I would like to come back on the question raised on the side of Sona, why do we engage men in Rwanda? In Rwanda, men are the power holders at the community level, and that is one of the social norms that perpetuate violence against women and against children in Rwanda. And then bring men is as if we are bringing allies to the program, so that when they become allies, they help to fight, even to challenge those harmful social norms and practices, so that we are creating an enabling environment for women and for children, whereby children can grow up in different ways. And now, when we involve the men, we are also challenging the power imbalance between men and women at community, at household level, but also at community level. So when men think and reflect on the power that they hold and the negative consequences of those power imbalance at home and in the community, they become allies to challenge those social norms, then those malpractices, those negative behavior, and then it become easy to integrate men in the program. So that was a simple compliment. And coming back on the question, when we implemented the Vandevereho pilot phase, we conducted an evaluation using a randomized controlled trial. And then when we presented the findings to the government, it was a great moment. The government said, the model is able to reduce violence against women and against children by 45% when we compare control and treatment. And when we engage the government in the transition to scale, from the conception, the implementation, monitoring, evaluation, we are working hand in hand, so that they are not a stranger to the program, but they understand the whole process. And now with this scale up we are conducting now, we continue to generate evidence, because in the government leaders in Rwanda, they are evidence-driven people. They understand when you have strong evidence. And then after the transition to scale, we conducted another qualitative and even quantitative research. And then we presented the findings to the high-level leaders, either with the Minister of Gender and Family Promotion, either with the Minister of the Health, either with the Rwanda Biomedical Center. And then the government leaders were convinced that the model can tackle the issue of violence against women and against children. And during this scale up, even selecting the geographic area of intervention, it was hand in hand with the government. I would say when you are working together with the government from the inception, from the planning, implementation, monitoring, and evaluation, it works well. And we are supported right now, because sometimes we are using the government human resources. We are using the government, let's say for the training, we are using the government premises, like training hall, they are provided by the government. During the monitoring of activity at community level, we are together with the staff from health centers. And I would say working together from inception, planning, implementation, monitoring and evaluation, and even the research. It is a good ingredient for the long run success. And we are now struggling for the buy-in, where government can provide maybe fund for that.
So there's this long-term collaboration. You don't parachute in with a research report, but you've actually been working over a long term with government. There's the dependence on evidence that it's effective for change, and also following the government's agenda. For example, if they're interested in a particular district, to support them in that particular site. I think those are really, really useful components to consider. I'm coming back to you, Suna, and continuing on this theme of going to scale. And father support aims to be implemented, the father support program in Turkey aims to be implemented at scale and hopefully adopted by public and other NGOs. What do you think is needed for gender transformative parenting programs to be successful at scale?
So we're coming to understand just implementing programs is not enough. We really need a shift in society that goes beyond programs towards policy. So we really need a bigger strategy because the kind of work that we're trying to do is shaped by a multitude of factors. Like I said, the challenges that we're trying to address are much bigger than us. So yes, definitely being able to implement in scale is very important, but at the same time, we require efforts in all fronts, programs, policies, support of public sector to scale up, private sector to also push the messages, mobilize stakeholders from the society. I mean, all the actors are very uniquely important in reconstructing certain messages and values, as you very well know. So over the years, we've started to gear more towards the private sector, similar to the ways that Equimundo does. At the same time, with public sector, some relationships and some partnerships changed, and we started working more with local governments, which opened up new doors to us. So I think the big questions answer is to be able to have some sustainable impact. We really need all fronts and all actors from multitude of levels to come together and work. I know this sounds a bit ideal, but this is needed for the bigger gender transformative parenting programs to be successful at scale. So alone as an NGO, you can only go so far.
And maybe just to double click on that briefly, Suna. So it sounds like you've got more traction with local government in this approach to work with the multi-sectoral promotion of the programs or adoption or support for the programs. In your context, where have you seen the largest involvement or uptake or enthusiasm?
So yes, in the last, I would say 5 years, there's a lot of traction from local governments. And then after the programs end, the program graduates have actually started their small grassroots initiatives. They were very driven to take the concept of involved fatherhood, engaged fatherhood, and they would in fact take it to the streets. Lately, there's a lot of traction from the private sector, where companies, institutions, they want to bring these programs under their roofs, be it through their human resources or general support to all their employees.
Great, thank you. No, that's wonderful. Colleagues might know, if I can just briefly plug the MenCare commitment, please go and have a look at the MenCare website. And that's one way that we're all working together, including with Achev, on trying to reach out to the private sector in various ways. But Jean de Dieu, let me return to you and the International Rescue Committee. The Safe at Home program, it was really interesting to hear about it. And I think this is a question that we touched on briefly before, but in working to prevent violence against women and children, it's important to ensure the safety of women and children reached by the program. Could you tell us about how your program set up safeguarding and systems and processes to manage the safety of particularly women and children participating in the program?
Thank you for this question. This is a very important aspect when we talk about the safety of women and kids. This approach, well, it is carried out with other actors. There are other actors that speak about, for example, the care, psychosocial care, medical care, an entire protection system. Or, for example, there's also this approach that speaks about prevention of violence against women and kids. And now this system, the safety system, has to do with the following. First of all, decisions are made on the side of men, and other decisions that are made with regard to women. So the goal, if there is, for example, a zone that is selected so as to address safety, and women are listened to. There are sessions as well that are carried out with women, and well, decisions are made along those lines, and the participation of these women in this decision-making group allows these women to have more power in a way. For example, a woman can show up for a discussion, and when she goes back home, for example, the man, for example, may have some reproaches against her and so on. So the violence continues to be perpetrated in that case. So with regard to the safety, then, for example, there are women that participate in the decision-making groups. It is for this reason that they may stop attending these groups because of the violence that is perpetrated at home. So we can, for example, we can speak about community leaders who, with regard to the presence of this type of activities within the community. And apart from that, there is also psychosocial assistance, psychosocial workers that may jump in if necessary. So apart from that, there are other reference tools. For example, when there is a problem with regard to the participation of women in a discussion group, we make sure that they are safe, and there are reference groups, and we also do work with the men, with leaders, and with all other important members of the community. But also there are difficulties with regards to women. Well, children, of course, also have the need to participate, and sometimes there are difficulties because sometimes the kids are at school, sometimes the kids go to school during the morning or after lunch or in the afternoon, so there is a logistical problem as well that is involved. There are also there are expenses that families have to incur in, for example, there. So kids, there can be sources of insecurity that have to do with money as well. So this will allow we try to make safety available to absolutely everyone, not just to guys, but also to women and kids. For kids, there is a safe space that we have especially designed, and this is in order for kids to feel safe so that they may be able to play around. There are sessions that are organized with these kids, and there are these spaces are great for the kids because they are very safe, and that allows kids to feel really happy because this enables safety for the kids. And when parents realize that kids need to be allowed to participate actively in these safe spaces, they accompany the kids into these spaces, and that can be really constructive for the family. Done in these spaces, there are volunteers who are trained in order to deal with the kids, and they also are experts in organizing the discussion around this topic and also in enabling safety. So it's quite complex, of course, but the support of everyone in the community is so important, and it's also important to have organizations in place both nationally and locally and internationally, so as to talk about governance with the community. And well, in this way we enable people to properly understand the importance of this issue, and of course everyone is encouraged to understand that safety is something that everyone deserves. And with regard to this topic,
I'm gonna ask you to close, Jean de Dieu. We're moving on. Sorry, is that okay? Okay, I'm so sorry. I know it's a very, it's a very comprehensive system.
So these are the aspects that I wanted to mention in connection with safety in general.
Wonderful, thank you. I really appreciate that. And sorry for ending that there. I wanted to just pass back to Clara in a moment, but to give each of you an opportunity to name one thing. So we've got 1 minute to do this. So you can each give one key catalytic opportunity you think there is to move the field forward and to increase collaboration, especially across the different sectors. So I'm asking each one of you for a quick comment, and let's start with Christina.
Well, I agree with many of the things that have been said, but Paternar maybe is the youngest of the programs that are being presented here, and we are taking that challenge of scaling up the program. So far, what we believe that is very important is that all the different levels of society should be involved, starting with civil society. We are also an NGO, but definitely we have to work with the state. In Colombia, there are different, very unequal levels, let's say, of implementation of public policies. So
Great.
scaling
Wonderful.
up entails understanding and knowing what the territories are about.
Thank you. Suna, 25 seconds.
I would say, in addition to working on the individual and family level through our parenting programs, ideally, we need to create a supportive environment of laws, policies, and an environment where we're having awareness raising and behavior change campaigns, so that at a community level there is that noise, background noise, that will be supportive to the work that we're trying to do.
Right. Emmanuel, last comment from you.
Thank you. I would say using a gender transformative approach is a key ingredient, but also working with the government to integrate this parenting program into the existing government implementation or action plan would be another value.
Right.
And also engaging leaders more, especially from high level to the community level, to support, let's say, for buying and ownership. When the let's say in our context, when Vandevilo is not operating in the community, the government can continue sustain what have been achieved.
Thank you, Emmanuel. Jean de Dieu, I'm going to give you the last opportunity before we go back to Clara. So literally 30 seconds. Sorry for the pressure.
Thank you. I would like to say that it's very necessary to implement this approach, and it is necessary as well to integrate the leaders, as well as Emmanuel has just said, because leaders are reluctant to introduce this kind of approach, but when they start to intervene in this approach and when they start to change, leaders can really make a difference. So it's really necessary to have the leaders chip in as well. Thank you.
Thank you. Merci beaucoup. Muchas gracias. Tashake. Thanks, everyone. Back to you, Clara.
Thank you so much. I don't want to take any more time. There's so many takeaways and reflections, but I want to give a space to some questions were answered already online. But we asked for questions, we promised for a space, so at least I wanted to select one or two and ask speakers to be super brief. One question by Tom, for whoever wants to respond, is, does anyone have examples of aha moments or breakthroughs working with male caregivers that appears to spark genuine transformation on the personal level and therefore in their relationships and wider communities? In case, if, when that happens, what approach sparked that level of deeper reflection on gender? Anybody would like to respond?
I can give a very quick response. In the Father Support Program, we have activities, and we've noticed that reflection activities where we ask the fathers to go back into their childhood, think of good memories, think of sometimes some negative examples from their own parents, from their relationship with their father, really always, without an exception, provides an aha moment. they feel very touched with both positive or negative experiences. And then from that, they're able to reflect and they say, I want to do the same thing for my child. I want to increase these good moments. Or if it's a negative experience, they say, I really don't want this to happen between me and my child. So that personal aha translates then into a motivation to change their behavior.
Thank you very much, Suna. I think it was a great example, and that's something that I think many other programs of presented today and others have seen that. A second question by Nikki, and I think several of you mentioned this, is it's great to see this happening, bringing together actors working on parenting with those working to prevent violence against women and violence against children. However, do you, any of the speakers, have ideas beyond programs such as Suna, Christina were touching on very clearly, possibilities that go beyond programs and address some of the more structural issues? Other ideas, I know there was a lot talked about changing policies and laws, bringing stakeholders together, changing practices within services, but I just open to others that might see other possibilities of going beyond programs to shift these behaviors. Yeah, who is?
Maybe I can share the experience of Rwanda. Maybe Vessel will help me. After the implementation of Rwanda and the other gender transformative approach in Rwanda, we come up to discuss with the government to have a clear men engaged strategy on the side of the government. That is one. You have also the parental leave in Rwanda was almost 2 or 3 days. Now we increased a bit the number of days, because when we present the findings and then the outcome, even leaders become more sensitive on the program, but also it opens doors to create a more enabling environment by creating new policies, new strategies, and that is not from the heaven, it's from the findings from Vandevereho and the other intervention. Maybe I would say Vandevereho is a part of Men Care Global campaign because it has been originated from the Men Care Global and then Men Care Plus and then Vandevereho. That for us, it is a good ingredient where government decided to change or to integrate to create something new based on the evidence that we have.
Thank you so much, Emmanuel. And I know we have 2 minutes left, maybe 2 more, so 4 minutes in total. I'm going to use one and then hand it over to Bianca, because I did promise to share the set of resources and tell you where you could access them. I hope you can see the screen. So I mentioned there were 4 resources that the Parenting Affinity Group, Equimundo, UNICEF Innocenti, and the Prevention Collaborative were about to publish, that discusses in very practical terms and providing very concrete evidence-based guidance on how to design or adapt parenting programs to address the types of issues we were mentioning here. So the first evidence-based resource is why is it important? It's making the case to governments, to public policy, to others already working on parenting programs for the need to work at the intersections and why violence prevention matters for these type of programs. The second resource is what do effective or gender transformative programs look like, and what are the key ingredients, elements for these programs to be effective in reducing both types of violence. The third resource is how can programs be adapted, and step-by-step guidance on how to do this, from understanding the context and in an ecological perspective, how to bring other stakeholders, as we were referring to before, but basically how can the programs itself, working with families and stakeholders, take this gender transformative approach. Lastly, how can change be measured? What are some considerations to think about when designing and trying to measure impact around these dimensions? These programs are right now in the hot press and will be coming out. So what I would ask anybody interested is to scan this QR code, and you will be in a short list or in a listserv, let's say, to receive these 4 resources as soon as they're published. And of course, to participate in other learning events with practitioners, researchers that are trying to join forces and concerted efforts towards this aim. So I wanted to thank enormously, again, every one of our speakers. I know everybody had personal, professional situations and made an effort to be here today and to share their knowledge and their experience. And I'm profoundly grateful to them, to Vessel, who facilitated, to Bianca and all of the Men Engaged team for inviting us all today. And I hope this is just the first of many conversations, and we can continue that. So Bianca, over to you.
Great, thank you so much, Clara, and thank you to all the speakers for this great presentation, and particularly to you, Clara, for all the work you've done in pulling this together and organizing and coordinating all the speakers. So thank you very much, and thank you again to all the speakers, and thank you particularly to everyone that's been with us today for your questions and just for joining us. It's always good to see so many people that are interested in these sessions. Thank you, everyone, and we will see you again. Take care.